I'm Shawn Baker, Chief Nutritionist at the United States Agency for International Development, and my role is to really help our agency, which address the burden of malnutrition in the world. Malnutrition drives 45% of under 5 deaths, and for those children who survive malnutrition, we've deprived them of optimal cognitive and physical development. So it's incredibly devastating for both children's lives, their futures, and the futures of any nation. If you look at the burden of deaths driven by malnutrition, Nigeria has the unfortunate ranking of being the biggest burden of all of Africa, the second burden in the world. So as I've spoken to people, I've reminded them that all of the ambitions of the African Union to address nutrition, if Nigeria does not succeed, Africa does not succeed. If you look at the broad strokes, you can say, well, there's not been, as you said, movement on stunting, or it's one of the ways we as nutrition people measure progress of are kids growing correctly or are they too short for their age. Because of the multiple crises, be it insecurity, food prices, etc., there are increasing rates of wasting. And let me give you some of the hope that I come away with after this week of travel. And first, sort of a very personal level, one of the first visits was to a primary health care clinic here in the Federal Capital Territory, right, in fact, not far from here. And despite how wonderful this interview is, with all due respect, it was the absolute highlight of my trip, because here you have moms who had been supported during pregnancy to get the health care they need, to get the nutrition they need. At birth, they'd been supported to initiate breastfeeding immediately. The moms and their families have been supported so moms could breastfeed exclusively for 6 months. Many of the children coming in, sometimes coming in with both mom and dad, were coming in because they were just turning 6 months and it was time to get counseling on how do you start introducing these complementary foods. So in addition to breastfeeding, make sure these young infants are getting those additional nutrients. And you know, I'm a technical person, right? You know, we all about how do you measure nutritional status. I'm also a dad and a granddad, and you know, you can just see the way these babies are glowing with vibrant health and just how vivacious they are, how proud mom and dad are of their babies, and how incredibly fulfilled the frontline workers are. So that clinic represents things working, and things working translating into kids thriving, surviving and thriving. And this was not some magical creation, right? This was the resources of Nigeria working together according to national policies and guidelines. So that gave me incredible hope. If I step back and look at sort of the national level underneath what can look sometimes like quite a grand picture, there have been some key successes I come across. So maybe I'll list 5 or 6, if you may. Let's look at vitamin A supplementation. So vitamin A supplementation, why are we interested in it? Because the evidence shows that in countries where there's vitamin A deficiency, not only is there a risk of childhood blindness, because vitamin A is essential to build the immune system, there are higher risks of child mortality. As in many countries, Nigeria has relied on certain campaigns here, maternal and child health weeks, to make sure you're getting out the kids who need the most and get from children from 6 months to the 5 years old. Because of the pandemic, operations needed to be suspended to avoid risk of transmission. So in Nigeria, as in many countries across the world, coverage just plummeted. But with the reinitiation in May of these maternal and child health days, Nigeria is back on track to get great coverage. That's a success story, that's great. I've worked a lot on large-scale food fortification. What's that? It's taking things that are consumed regularly here in Nigeria. It's salt to make sure iodine is there, wheat flour to make sure iron and folic acid are there, cooking oil, vitamin A, sugar, vitamin A, etc. That these are securing essential nutrients in these commonly used staples. And that's particularly important in times like this when families are really struggling to afford a nutritious diet. So I think of providing a essential safety net of these vitamins and minerals. And Nigeria for several decades has been a leader in ensuring salt iodization and has really improved dramatically the coverage and compliance of these industry of doing that. The third, programmatically, I would look like are breastfeeding rates. If you go back to about 2013, the Demographic and Health Survey showed that exclusive breastfeeding rates were about 17%. So 17% of infants 0 to 6 months were being exclusively breastfed. And at that point, when we did calculations, that translated into about 100,000 children's lives being lost a year to suboptimal breastfeeding. Now, of course, there are lots of positives because, of course, breastfeeding is the norm in Nigeria. So it's not like you're trying to make some major shift. It's like around the edges, how do you make some improvements so that moms are able to initiate within the first hour exclusively breastfeeding, which means breast milk is providing everything, including adequate water, and then start the complementary foods at 6 months and continue breastfeeding. So from a rate in 2013 of 17%, I think in 2018, and you probably have the Demographic and Health Survey data in front of you, it went up to 29, and the last survey I spoke about in 2021 shows it going to 34%. That's an upward trajectory, and when you talk about can more be done? Absolutely. I mean, I was telling people, let's aspire to Rwanda levels of exclusive breastfeeding, which are 87%. But I think if you can start that trajectory in a nation of over 200 million, that's a huge change and it's doable. The National Nutrition Council has been around on paper for, I believe, since 2007, and under the leadership of the Vice President, it's really been incredibly revitalized. And since 2017 has taken form, has become, I think, an effective platform to elevate this. Some of the latest decisions was to make sure that the respective ministries would elevate nutrition to a department level so that they have a bigger place at the table, start putting line items for nutrition in budgets. Nigeria has 3 producers of ready-to-use therapeutic foods. They have they have all the technical capacity to produce this at international standards. And I think not only could Nigeria produce enough for all of its own needs, it could produce for certainly all the needs of the Economic Community of West African states and also other countries in Africa. So what I walk away with is that the policies are in place, the systems are in place. It's about delivery, delivery, and delivery. And there have to be these 2 components of delivery to make sure within these systems the frontline workers have the right capacities to do it and that the right financing is going in. We know how dynamic and powerful this nation is with this burden of malnutrition. Imagine when this nation is liberated from this burden of malnutrition, how powerful this nation will be.